Bell's palsy. Why would someone suddenly start complaining at first of a vague pain around their ear that they don't understand and don't see a doctor for? And then within a few days, they find that the left or right side of their face won't move at all. Meaning they try to raise their eyes, one goes up and the other doesn't. They try to raise their eyebrows, one goes up and the other doesn't. They try to close their eye, one closes and the other doesn't. They find their face isn't moving. They try to smile, one side pulls back and the other doesn't move, so they get terrified. Well, this condition is called Bell's palsy, is a type of inflammation that occurs in the 7th cranial nerve. To this day, we don't know its cause. Some people say it's due to viral infections. Others say it's an autoimmune disease, and some say it's caused by exposure to drafts, like opening the car window while driving. A strong gust of wind hits them. They say they felt a little pain, and then this happened. I woke up and found my face wouldn't move. Okay, we don't know the causes, but what happens is the swelling we talked about. For an unknown reason, this nerve swells a bit, and as soon as it swells, it presses on itself, reduces the blood flow to it, and stops working. So we shouldn't be afraid. What do you mean, doctor? Will it get better? Yes. 90% of cases have a 100% recovery. They completely recover and the nerve goes back to working 100% within a month. Look, everyone, what has happened is a condition that affects the 7th cranial nerve. This 7th nerve is what controls the movement of all the muscles in the face, the muscles of the face, starting with the forehead muscles that create the wrinkles you see when we raise our eyebrows, the muscle that lifts the eyebrow, the muscles that close the eye, the muscles that move the face, moving my mouth like this, right and left when smiling, and the muscle that helps us press food against our teeth while we chew, if we have food in our mouth. 7th nerve originates from the brain. It first enters the ear, travels through, and exits from an opening in the bone right under the ear. It then enters the parotid gland, the salivary gland located here, and divides into 5 terminal branches: a branch to the forehead, a branch to the eye, a branch to move the lip and the buccinator, and a branch to the neck. Alright, now the main problem is that the 7th nerve passes through the ear inside a bony canal, a canal made of bone. This bony canal means that if swelling occurs in the nerve for any reason, the nerve gets compressed inside this canal, which is enclosed on all sides. Consequently, any swelling puts pressure on the blood that nourishes the nerve itself. So, if the nerve swells for whatever reason because it's not in a space that allows it to expand, this swelling then presses on the nerve itself, which harms it and cuts off its blood supply, thus worsening the problem. It can also recur in about 12% of patients. We worry if it returns on the same side. But if it returns on the other side, it's fine. We treat it normally without needing scans, and there's no need to worry or be afraid at all. Meaning, if this problem occurred in this nerve and healed on the right side, and then after 2, 3, 5, or 10 years, it appeared on the same side, yes, then we must do an MRI to ensure there's nothing pressing on the nerve. Of course, it has degrees. We actually divide it into 6 grades. The House-Brackman scale is a classification system. We grade it from normal to someone who can't move at all. And in between, there are grades. One person might be able to raise their eye, another can raise their eyebrow a little, and another can't at all. Someone might be able to close their eye with maximum effort. Their eye closes. But for another, no, it stays open. So it has grades. Whatever the grade the patient comes to us with, the first thing is that the patient must be completely reassured. This problem happens, and we don't know its cause. It happens in pregnant women. A pregnant woman can come in with it, or someone with diabetes can get it. These are very common. Diabetes and pregnancy are among the things that make this nerve more susceptible to inflammation. So we shouldn't be afraid. What do you mean, doctor? Will it get better? Yes. 90% of cases have a 100% recovery. They completely recover, and the nerve goes back to working 100% within a month. A month is a long time, doctor. Well, it takes a month to heal 100%, but a very large percentage recovers 100%. So what do we do? What tests? Do we do brain scans? No, all the new recommendations say there's no need. If the problem is in this nerve alone and no other nerves are affected, how do we know this? Through an examination by the doctor, the ENT doctor, or the neurologist. When they see that only this nerve, the 7th nerve that moves the face, is the one with the problem. And as I told you, someone was exposed to a draft or had pain around their ear, and this happened, we don't worry, and we give a treatment based on cortisone. Why is cortisone given? It's given because cortisone is the best drug to reduce swelling. So, since we don't know the cause, we give cortisone. This is the only thing proven to be effective. Other than that, we don't need other treatments. All other treatments, along with cortisone, we give something for the stomach because cortisone increases acidity, and we give this cortisone treatment for about 2 weeks, and God willing, they recover during that time. We also give an ointment for the eye and drops because the eye remains open and the eye being open and not moving, not blinking, can harm the cornea. We advise the patient to always wear sunglasses, especially when outdoors, as this helps protect the eyes from bright sunlight and reduces discomfort. It is also important not to be exposed to dust, since dust can irritate the eyes and make symptoms worse. Additionally, we recommend not going out much, particularly in places where there is a lot of wind or pollution, to further reduce the risk of eye problems. By following these precautions, we hope to avoid common issues we see, like dry eye and irritation. Also, for the facial muscles, many times we start physical therapy sessions a week after the problem occurs, to keep the muscle in good condition, because God willing, the nerve will recover well and find the muscle in good condition, so the muscle hasn't developed fibrosis or things like that. Then the nerve would be working, but the muscle has a problem and the patient recovers in a very, very large percentage. It's no cause for alarm. So, doctor, is there no cause for concern at all? Well, look, this issue arises if more than 2 or 3 weeks pass and the nerve is not moving, a complete palsy. Then we might request scans and tests and things like that for the nerve to check on it. We might request scans, an MRI, a magnetic resonance imaging of the nerve, and so on, and suspect something is pressing on it if, after 2 or 3 weeks, it hasn't recovered 100%. Or if from the beginning the nerve wasn't moving at all, we might request tests and scans after 2 weeks. Or if, God forbid, we find other symptoms with the 7th nerve, not just it alone, other things that would make us request scans. Or if problems have occurred in the eye or muscles, these things require treatment from an eye doctor and so on. Also, there's something very important. The 7th nerve often comes in families, meaning it has 10% of cases are in families, meaning it has a family history that my father, my mother, my grandfather had this happen to them. It can also recur in about 12% of patients. It can come back. We get worried if it comes back on the same side. But if it comes back on the other side, it's fine. We treat it normally, we don't do scans, we don't worry, and we're not afraid at all. Meaning, if this problem came in this nerve and healed on the right side, and we find that after 2, 3, 5, 10 years it came back on the same side, yes, then we must do an MRI scan to make sure there's nothing pressing on the nerve. Let's not worry, let's not be afraid. This issue is terrifying, it's true, for someone to wake up and find half their face won't move, but 90%, God willing, of patients recover 100% and no one can notice anything about them. We wait for the month and God will grant healing, God willing. Get well soon. If you like these videos, give them a like and subscribe to the channel so the channel's subscribers increase and we know you're waiting for more videos from us. And a million get well wishes.